Ty Brady here with Brady Insurance Marketing and the Ty Brady Way. As a successful entrepreneur myself, I'm passionate in helping other entrepreneurs do the same as they rise from rags to riches and get inspired each week on the stories they tell here at the Ty Brady Way. Welcome back to another episode of the Ty Brady Way today. Oh, that was a mouthful. But today I want to talk about the state of the insurance industry, whether you're selling Medicare or Medicare health plans or whether you're selling affordable healthcare insurance. You know, there's a lot of noise out there and a lot of turmoil. And I wanted to speak to a little bit of background on what got us to where we're at today. First of all, you got to go back to when the Inflation Reduction Act was signed into law. A lot of the things that we are facing today was because of the Inflation Reduction Act. Yes, there was a lot of good things signed in that bill. There was a lot of things that I don't necessarily agree with in that bill as well. But especially on the Medicare side, one of the things that insurance companies have struggled with and had a hard time with is reducing, if anybody that's been on Medicare before the Inflation Reduction Act was in play, there used to be a thing called the initial coverage, the coverage gap, or the donut hole, and then there was the catastrophic coverage. Well, because of the Inflation Reduction Acts, they capped the max out-of-pocket on a drug plan to a certain amount. And when that was capped, put a lot more responsibility on the insurance companies. Well, anytime something new is introduced, it's going to require companies to figure it out and actually understand what that means. Insurance is about offsetting risk. And the more money you put into the pool, is the more money that then can be redistributed and put out. Well, at some point, if there's more money being taken out of the pool, they've got to figure out how to stop the bleeding and stop the leak in that pool. So that's where we're at today. So a lot of this happened because of the Inflation Reduction Act, putting more responsibility on the insurance carriers on the drug side. So look at today, right? That's just one component, is the Inflation Reduction Act. The second one is inflation and the cost of healthcare. So you're hearing a lot of noise out there that a lot of PPO plans are exiting markets. Well, that is true. And the reason they're exiting markets is because of those two things, inflation and then the cost of healthcare. When, again, an insurance company cannot stop the leak in the pool, they're going to have to figure something out. So what did they do? They basically said, hey, these plans are exiting. That is one thing. Or they cut commissions, right? They don't want to continue to receive business and make the problem worse. Money comes in, money's going out. It's not sustainable. It's not good for the member. It's not good for the insurance company. It's not good for the doctors. So everybody's losing in this. It's not good for us as insurance agents. So as we understand what's going on, it helps us better educate our consumers. And I'm sure there's going to be some consumers that get on this call and like, what is going on with my healthcare? Well, that's on. So PPOs are leaving markets. PPOs are getting cut in commissions. So they're trying to stop the bleeding and figure it out. But here's what we have to understand too. If somebody goes on a PPO, that's more responsibility for the member. That's me as the member. As I go to the doctor, I have to make sure the doctor is willing to build a plan. The cost that I may have to pay out of pocket could be higher, right? So there's a lot of things at play. Now, with a PPO, did it give people more access to doctors that may not be on an HMO plan? Sure, it did. But at what cost? So we're getting back to, people are like, well, the sky is falling. And I'm like, listen, as long as we've been in this industry, I've been in the industry almost 16 and a half years, there has always been change. And there will continue to be change. And that's one thing I can guarantee. There'll be change. Back when I was in construction, I used to tell people there's two guarantees with concrete. It's not if or when it's going to crack, right? It's the same thing. As things keep changing, we're going to keep changing. I go back to my mentor. My mentor used to say this about Medicare Supplements. He says, you cannot have these three things with Medicare Supplements. And if you do, the company will fail. You can't pay the agent the highest commissions, the easiest underwriting, and the lowest premium. You can't do those three things. If you have the lowest premium to the consumer, the easiest underwriting, and the highest commission to the agents, at some point that book of business is going to fail. So all we're doing right now today, this industry, is there's a massive reset. Some people call it a rodeo. We're in a big rodeo. But guess what? There's still opportunity out there and to help your members. Health insurance isn't going away. And it obviously today, PPOs are getting hammered. And the other thing is a lot of people said, well, I put them on a PPO because they travel from state to state. I'm like, well, there may not be a need for that. Just because they're on a PPO doesn't mean it gives them the care, because if we go back to, they have to make sure the doctor is willing to accept the plan and build the plan. And then they said, well, I did that instead of a Medicare supplement. So let's look at these three things. You have an HMO. HMOs usually have a gatekeeper or a referral. They want you to go to your primary care doctor first. They want you to go to your primary care doctor first. Why? Because your primary care doctor then has to send a referral to a specialist, whether it be a shoulder surgery, a knee surgery, whatever it is. Maybe it's indigestion or heartburn, right? Somebody thinks they're having a heart attack and they immediately go to a cardiologist. These things aren't wrong, but they go to their primary care doctor first. They establish a relationship with their primary care doctor. The primary care doctor is incentivized to have a relationship with the patient. And then you're incentivized to go get your preventative checkups, right? As you go do your preventative checkups, your quality of care and the way, or the sooner they catch the disease or diseases, the quality of care goes up, and they catch it sooner, and the cost of care goes down. So it's this perfect thing where, not a perfect thing, but as you go to your primary care doctor, that's what an HMO is, right? You have to go to network doctors. You go to those network doctors, they help control cost. When you talk about inflation on the PPO side, you can't necessarily control that cost as an insurance company. So as an HMO, the doctor signs a contract that they're willing to accept the amount, the negotiated rate, and then you as a member agree to go to your primary care doctor before you go to a specialist. On the PPO side, that's not necessarily the case. So if you wanted to go to a specialist, they're willing to build a plan, they're willing to accept you're willing to pay the additional amount on the side of the PPO, or the member is, then they can do that. Now, is it perfect? No, but it's just understanding what we're living in today and what we're dealing with. There's not a perfect answer, but it will get better, and the sky isn't falling. Is there some people that are going to have to do a massive reset? Sure, I'm one of those. There's a lot of my agents that are affected in certain areas across the country, and we're coming up with strategies and game plans on, okay, what is available? What can we do? How can we help the member? And then how can we continue to move forward? Because it's not going away. And on that, so we have HMO, PPO. Now I want to talk about areas where they completely lost their plan altogether. We know that if a plan leaves an area, it's called service area reduction. That gives people the opportunity to go on a Medigap policy or a Medicare supplement policy without having to answer the health questions. What does it happen to the member, though, if there's not a Medicare Advantage plan in that market, in that county? Those Medicare Advantage plans are going to be expensive, or could be expensive. So you've really got to take a good look at, okay, how can I help my clients and serve them the best given the situation that I've been given? So, and what I would tell you is, as much as possible, if you can send that consumer through underwriting, maybe it's a high deductible F plan, maybe it's an L or a K, but getting them something that protects them against the co-insurance and the deductibles with the original Medicare. And then you got the option to put them on a drug card or a drug plan. And those are expensive this year as well. So you've got all these different things going on. Now, your existing members, I would encourage you to do this. Have those conversations with your existing members. Ask them the question, what do you like about your plan? What do you not like about your plan? If you had a crystal ball, what's something you would like to have in your plan that you don't have now? Something that I've been asked a lot right now is about dental plans embedded in the health plan. And then I'll get to drugs in a second. But I am not a fan of Medicare Advantage plans that have an embedded dental benefit in the health plan. And here's the reason why. As soon as the member goes to a dentist and the dentist says that is not covered, they're wanting to switch their entire health plan. It's not that their health plan is bad, but it's the dentist said it's not covered, and then all of a sudden they want to switch. I don't foresee in the distant future that a lot of Medicare Advantage plans are going to have a lot of embedded dental in their plan. You're going to see Medicare Advantage plans, I believe, that have a dental rider, but I'm a fan of writing a standalone dental plan because it's standalone, it's not embedded in their health coverage, and then if something happens, it's not calling you up saying, hey, I want to switch my health plan altogether. But it's those little things and educating consumer when you ask them what they like, what they don't like, what they would like to change, making sure their doctors in network, their drugs are covered. The two things that I get the most calls on are this: the cost of drugs. That used to be a big issue. That's not necessarily a big issue now because of the max out of pocket that they hit on the drug, and that's 100% after that. So then it goes back to the dental plan. And a lot of people want the first thing they ask for is dental implants, right? And dental implants, there's very few, if any, that cover dental implants. And I think that goes back to the dentist not willing to do a root canal. They'd rather pull the tooth and put an implant because of liability. I know my personal doctor refuses to do root canals. He's like, no, I'm going to send you to a root canal specialist because he doesn't want the liability on the back end. But I can tell you that all of the pretty stuff, I call it, that post that I got, I had a lacrosse ball hit my cheek. With that lacrosse ball, I had an old root canal that cracked. And when it cracked, it got infected. So I've been through that process where I had to get an implant and all the process. All said and done, it was $3,800 cash. So it is expensive. But we do know that if people take care of their health and people do those things, but people's health gets better if they take care of their teeth, if they take care of their teeth, their health is better, right? So as you talk to your members, there's lots of good standalone dental programs out there. Yes, they cost anywhere from $40 to $60 a month. Some of them have waiting periods. So I've always at least given that option because people need it. And it may be a discount program when it comes to dental. Now, on the drug side, the easiest thing to do on the drug side is making sure that consumers' drugs are covered. If you do that, you're good. So all the things that we used to deal with as an agent, as long as it's covered, we know that at some point they're going to hit the max out of pocket, and then it's 100% after that. We're going to go through some more turbulence, and it's not as bad as you think. There is turbulence, but with turbulence, there's opportunity to talk to more consumers, and we need to educate them. We're in the education profession, I believe, and as you serve and educate those members, whether it's, what's going on with the Medicare supplements, what's going on with Medicare Advantage, what's going on with prescription drug plans, as we help educate people on those things, we're better for it, and so are they. You're in a tremendous time, right? I was reading an article by 2034 that the Medicare Advantage enrollment predictions will almost double by 2034. I mean, you're talking 9 years away from now, and they're going to figure it out. But in the meantime, there's turbulence. Does it affect people? Sure. That not only does it affect the consumer, it affects us as agents, it affects us as agency owners, it affects the doctor. They're going to figure it out. So it's a win for everybody involved, and we can continue to move forward. This industry is not going anywhere, despite all the negative noise. I read an article back in early 1980s. The New York Times started posting a lot of negative news, and their ratings went up. So negativity is really easy to find. Positivity, you've got to look for it. And I know that we could all come out the other side of this turbulence, or whatever we want to call it, this rodeo, that we can all come out bigger and stronger, and everybody can win. The insurance company can win, the consumer can win, and we can win as agent. Pass this along to anyone you'd feel like you would like to. And as always, share, like, and subscribe, and we'll catch you on the next one.
Thank you for listening to another episode of the Ty Brady Way. As always, share, like, and subscribe. Go to Instagram at ty.r.brady. And as always, love hearing from you. And let me know what you want to learn on the show or what you'd like me to bring up on the show. Thanks.
You can find the Ty Brady Way on Instagram as well as Facebook. To stay connected with giveaways and Ty himself, go ahead and follow at ty.r.brady on Instagram as well as Facebook. This podcast was recorded, edited, and produced by Whitney Face Media Marketing. The theme music is an excerpt from Hot Chicken of the Woods by Isaac Joel.